Hi, this is Randy. I just wanted to comment on Running from Chaos's most recent video. She's um, kind of talking about, and then she answers her own questions about mental illness, personality disorders, and emotional injury. And this indeed must be very confusing to people. Because when we talk about the narcissist, we'll make fun of them and say that they're mentally ill. And we also acknowledge that they may or may not have had trauma. And then those of us who have had trauma resent being called or labeled mentally ill in any way. And sometimes we get confused as having a personality disorder. And then people with mental illness may also have trauma, so they may think that they only need treatment for the trauma, where they also have some kind of chemical imbalance that they also would need to have treatment for. So it gets real mixed up and confusing, these three different kinds of ways that people can have mental issues. They also develop over time. They overlay on top of each other, which is called dual diagnosis. And most people who end up getting diagnosed with anything, if you're able to understand them for over a period of time. Well, a diagnosis is only a snapshot in time. Okay, it's not a cumulative, and it can't predict the future. It's a snapshot in time. There's things that cloud an accurate diagnosis. The more each time you pile another diagnosis or another group of symptoms, and you start seeing another group of symptoms, or something new is disclosed that the therapist or the psychiatrist was unaware of, you can add another diagnosis because the person will fit the criteria as having the symptoms. And that's all diagnoses are if you fit the criteria in the DSM, and then you're qualified to diagnose. That's the book that they use. I mean, it's not secret, it's not hidden. Anybody can look at it, anybody can read it. So in the field, psychiatrists try not to slap heavy diagnoses onto people under 18. Rather than calling it mental illness, they like to call it, behavior problems, emotional problems, because some kids do totally grow out of it. They'll present in certain ways, and they'll grow up, and then their symptoms will really subside a significant amount. So you don't want to slap on to a young child a serious diagnosis that can carry with them kind of as a self-fulfilling prophecy, because there are so many cases where a child will adapt and adjust, and they'll get better. Now, personality disorders, you cannot diagnose them until you're over 18, until the person is over 18. And they're so difficult to diagnose, but there is no cure, and the field of mental health knows that. So getting a personality disorder is kind of like a side note. It's kind of more like okay, staff, if you read the group of diagnoses we have here on this fella, you might want to take note. He's got a personality disorder combined with all the other stuff, so watch out. When someone's diagnosed with a personality disorder, it's not really for them. There's nothing to help them. It's for the people around them. It's for the staff. It's for the people in the family, if they understand that, which they do understand that, but they just don't know what it was sometimes. So getting a personality disorder diagnosis is kind of just like, everybody knows there's nothing you can do about it. Everybody knows you got to tread carefully, stay away. And the other thing is, you have to also see if there's other stuff, if there's trauma, and if there's other chemical-based kind of mental illness, which all three of them can be present. You could have mental illness, personality disorder, and trauma. So even though your personality disorder isn't going to get cured or fixed, some of the symptoms of your mental illness or your trauma can improve with medication, possibly, or talk therapy. And so that's why the combination of diagnoses of a person is so overwhelming, and that's why there's so many possible treatments, and you're kind of drawing at straws to see what's going to work, because even one of these things by itself isn't going to be a sure thing that, okay, this medication is going to work for this one thing that you have, like say it's paranoid schizophrenia. But if you do only have one thing going, you haven't had any childhood trauma or adult trauma, you don't seem to have a personality disorder, but you just have a straight up mental illness, you got a better chance at getting better if you cooperate with medication. But if you also have the personality disorder, that's always going to be there. Now, if you're somebody with trauma, you're going to be more likely to benefit from talk therapy. But what they did was they found that when they were treating people with the serious, severe mental illnesses that seemed to be chemically, organically based, when they treated them with certain medications and it helped, they said, well, maybe we'll try it with some of these other people that don't have a chemical imbalance, and maybe that'll help them. But if your problem comes from nurture and not nature, which there's always debates on anyway, what these things have come from, but if you think your problem came from nurture and none from nature, then talk therapy, self-help, and at best a short stint of medication or holistic meds, holistic kinds of remedies are better. You don't want to get labeled, and you don't want to get put on some kind of serious psychotropic medication for long term if trauma and basically nurture was your only problem. You have no underlying personality disorder, and you have no other chemical imbalance that you were born with and then developed or got triggered later on. Usually the serious mental illnesses, a lot of times they don't trigger until like early adulthood, around age 25 or so. If you're gonna become a schizophrenic, you probably will have had your first schizophrenic, psychotic break, around early 20s to mid 20s. If it happens later on, when you're an adult, then you kind of even question, was that a psychotic break or was that drug related? I mean, it gets really, really complicated. And so you just have to know that The reason why the mental health professionals don't sort it out for you is because they don't have time and they don't see a long-term picture of what was going on. And even if they could see into all that, even if they could see into your body, could see into your past, and could definitely tell if you were dealing with personality disorder or not, it still would be guesswork as to the best course of action. It is not an exact science. So just like medical doctors don't always have the answer for our body, psychiatrists and psychologists aren't going to always have the answer for your mental well-being. You have to participate in it. You have to try to figure it out as much as you can on your own. And if you still need assistance, like psychotropic meds, talk therapy, then weave your way toward what it is you've decided that you need. And don't rely on a psychiatrist or psychologist to just be like a magician or a mind reader to be able to sit with you for an hour or even 3 hours and be able to come up with an accurate picture of what's going on with you and whether or not it was nature, nurture, and then the perfect cure. It's just not going to happen, and it's not a realistic expectation to have. So I'm really glad that Running from Chaos mentioned all this and that she's thinking about this. And boy, it means she's really really thought deeply about it. And most people don't really care to think that much about the differences. That's why, throwing out the term crazy or mentally ill is easier, because, you can say crazy and it can mean all these things. But if you really want to get down to like differential diagnosis, this is very difficult. It's difficult for the professionals. Best person to try to do it is yourself, unless if you have one of those mental illnesses that interferes with your thought process, you're not going to be able to do it yourself. You really need to go to that psychiatrist. If you have the personality disorder, the psychiatrist and no one's going to help you. You're gonna just screw them up. And then if you have the trauma, if you have the trauma and it's just trauma alone, and you can point to it, and that's your symptoms, you can try the holistic, the talk therapy, the self-help YouTubes and all that you're already doing. And you'll probably start getting better. All right. Thanks for listening.